Okay.
So maybe just to be safe, I should record this Zoom as well, just in case
That's
there's
fine.
any issue.
It shouldn't be a problem.
Yeah.
Yeah, what? Okay. Yep. So what he's doing right now, Doug, is that he's doing a secondary backup on his laptop just in case. So, okay, good. Excellent. Okay. Okay. What about now? Yeah, because you have to select it on the touch panel. So that's all I had to do. I had to select on the touch panel to push the the ceiling camera to you through the video feed. You always have to select it on the touch panel to push the video. Okay. All right. I just want just a note that let's say if you ever do the recording
Mm-hmm.
all the time, if you want them to see you from the room,
Okay.
you have to select the camera. You just press it once, and it should be good because you have to push the feed so that camera can see you.
Okay, so when I come here, I have to push this camera. Is it right now on, or I have to push it again?
I did. It did. You can't do both. You should be able to do both on Zoom, secondary and primary. Okay. No, I know that, but I'm talking about in Panato, you're able to do both at the same time. You could do the PowerPoint as a secondary and okay. 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 I'll just hit about now. Okay. All right. I didn't do anything. All I did is put a new computer in there and we added the software and mhm. The only thing I did is I just selected laptop, Doug. That's all I did. And then mm, mm. Yes, he does. He's not talking right now. He's just waiting to get started. Yeah, I'm here. We good? Can you talk some more?
Hello? Test, test.
Okay, so we're gonna have to use this web camera so they can see you.
Okay.
Because for some reason that one's not working on his end. So
Yeah, it's
just
fine.
want to let you know.
So yeah, I have my
He's
camera.
okay with that, Doug.
Yeah.
We'll have to address that at a later date. Okay. He's preparing a recording.
Okay.
Yes, on his laptop. He's using the camera built into his laptop. Mm-hmm. Okay. Mm-hmm. Okay. One more minute, please.
Mm.
Every time he makes a change, it takes 20 seconds for it to apply. So that's why every time he does something in the settings, it takes 20 seconds.
Okay.
There's a little bit of delay for it to.
Yeah. Okay.
Yes. On which camera? The one on his laptop or the one? Okay. I'm moving around. You're trying to see if if it freezes or if there's a lag. Okay. Okay. Can you talk a little bit so we can verify audio?
Yeah. So can you hear anything? Test. Microphone.
How's everything? Check. You good? Seems good?
Yeah. Okay.
All right. Good. All right. If you have yeah, thank you for your time. I appreciate
Yeah,
it.
no
If you have
problem.
any issues, Doug, just let me know and I'll come back, okay?
Okay. All right.
Thank you for your time.
Thank you. All right.
We apologize for the.
Yeah,
for
no
the
problem. I
inconvenience.
understand. So I think every time,
Okay.
this is gonna.
I'm gonna leave it. You can
Okay.
start. No
Okay.
problem.
All
Thank you,
right.
Doug.
All right. Thank you. Okay. All right. Good afternoon, everyone. Sorry about that. So, because this is gonna be recorded every lecture, so we happen to have some technical difficulties, and also apologize to the student joining online. So we just have some technical issue here in the classroom because of I think they changed the system or something. So we have to reset up. Okay. So for today, we'll continue talking about medical image, different imaging modalities. So last lecture, we've talked about X-ray and the CT, right? So just a quick recap. So X-ray and the CT, they're using the same, principle because basically they're using the ionized radiation, right? So you generate like a shadow. Any of the radiation can be absorbed by different tissues or can be passed through, and whatever the energy pick up by the scanner will be shown on the eventually the X-ray or CT images. So the key difference of the X-ray and the CT is that X-ray is just a single image, but the CT is because the X-ray source will rotate around the body, will generate multiple slices. And because of the volumetric nature, like the 3D nature, right? So we also talk about this kind of different terminologies, like the three different views: sagittal view, corner view, and axial view. So this will be used, and we will see a lot of papers. They talk about these different views. Be better. Can quickly on the back. Is it better? Yes. Okay. All right. So today we'll talk about MRI, so which is magnetic resonance imaging. So this is also a type of modalities that is able to make an image of the internal structure of the body. The MRI scanner uses strong magnetic field and also radio waves. So the radio wave is basically sending the energy so to disturb the magnetic field, and then later there's there's also the detector will able to collect the remaining energy to form an image. Okay, so that's a different mechanism to generate the image. So here I have a video just to quickly give you an overview, right, how the MRI imaging process is. Then next, we'll also show you the basic principle of MRI. Okay, so let's take a quick look at the video.
Helps doctors find, watch, and treat medical problems. MRI uses very strong magnets, radio waves, and a computer to make pictures of the inside of the body. MRI pictures are more detailed than those made with other methods. There are many reasons to have MRI. MRI may find bleeding, such as bleeding in the brain. Brain changes, as in stroke. Problems with your back, such as a herniated disc. And an injury inside the body, such as a torn anterior cruciate ligament. Before MRI, you will remove all metal objects. And it's not safe to have MRI with some medical implants. You should tell the MRI technologist about any metal, device, or implant you may have in your body, such as a pacemaker. To prepare for MRI, you will lie on a table just outside the scanner. MRI scanners are very noisy, so you will probably wear earplugs or headphones. Different equipment, such as pillows and straps, will help you stay in the correct position. Once you are ready, the table will slide into the scanner. Most often, closed scanners, such as this one, are used. The area inside is very narrow. In some areas, open scanners are available. This scanner is open on the sides, so you won't be completely surrounded by the machine. However, the pictures may not be as good as with closed scanners. For either type of scanner, a technologist will operate it from the next room. You will be able to talk to each other through a two-way speaker. During the scan, magnets in the machine will create a strong magnetic field. This will not harm you. Then, the scanner will send radio waves through your body. This will not harm you. When the radio waves are turned off, the scanner will pick up energy signals from your body. These signals are used to make the pictures. During the scan, you will have to stay very still so the images will be clear. You may be asked to hold your breath for a short time. MRIs may take 30 to 45 minutes or longer to complete. In some cases, you may get contrast dye with your MRI. The dye helps make clearer pictures. After the MRI, you can resume your normal activities.
Okay, so that's the procedure of the MRI. For the next video, just give you a basic principle, right? How this MRI using radio waves and also strong magnetic field to able to imaging their internal structure. Okay.
MRIs use protons, which are abundant in the human body. All protons spin, creating a small magnetic charge. When a strong magnetic field is introduced, as is the case in an MRI machine, the protons align with that field. The MRI technician then introduces a radio frequency pulse that disrupts the proton and forces it either into a 90-degree or 180-degree realignment with the static magnetic field. Since the radio frequency pulse pushed the proton against its nature, once this pulse is turned off, the protons realign with that magnetic field, releasing electromagnetic energy along the way. The MRI is able to detect this energy and is able to differentiate various tissues based on how quickly they release energy after the pulse is turned off.
Okay. So just to give a quick summary, right? So how does this MRI machine works, right? So basically the body is mostly water, right? So, and also water contains hydrogen atoms. So when we place, the human body in the strong magnetic field, right? So these hydrogen atoms in your body will act like a compass needle, okay? So when there's a radio wave, like a pulse introduced, right? So as we see in the video, right? So we're sending this RF pulse through the machine. This will kind of disturb the magnetic field. So these hydrogen atoms will kind of rotate, okay? So when we turn off this radio frequency, right, and these, the protons will basically return or realign with this magnetic field, and this process will emit or release energy. And the scanner is able to pick up this energy and to form an image. So that's the basic, a very basic principle of how MRI make an image of your internal structure. So, but why MRI can, differentiate different tissues, right? So we are able to see, different tissues will appear different, like different brightness, right? Different shades of gray. So the reason is that, different tissues in your body, right, containing varying amount of water and fat. So for example, right, the muscle has high water content, right? So fat has high fat content. And these hydrogen atoms, right, after being excited by the radio waves, so they can release energy at different rate based on the tissue, right? Different type of tissue, right? Because of these different water and fat content. So because of these relaxation time, that will result in, different contrast in the image. So for this relaxation time, there's two key, times we consider for this MRI. So one is called the T1 relaxation, right? So basically measure how quickly the proton realign with this magnetic field. And there's another one called the T2 relaxation time. Basically measure how quickly the hydrogen atoms losing their coherence, okay? And, different tissues have very different, T2 and T1 and T2 property. So this will create a contrast in the image. So later we'll also mention these T1 weighted or T2 weighted sequence. So that is basically, focus on different tissues, their T1 and the T2 property, okay? So this figure shows the basic, the system components and the function, right? So for this MRI system, we'll have, these radio frequency coil, right, to generate these radio frequency. We also have the grading coils, basically gonna do the spatial encoding of the XYZ position. And also we have this magnet, right, to generate those strong magnetic field, okay? So we'll also have the scanner, which will able to, pick the energy that is released by the proton. So the magnet is the largest and probably the most expensive component in the MRI scanner because you need these magnets to generate a strong magnetic field, right? And depending on the strength of the magnet, so these MRI scanners, can be classified or measured based on this magnetic field, right? So this is the measure of the strength of a magnet is called Teslas. Right, so typically, some medical or clinical MRI scan will have 0.1 T to 3 T. So that's the strength of some of the typical MRI scanners. But for some of the MRI machines, right, because the stronger magnetic field, you are able to generate more high-resolution images. So for research purposes, you may have to using a stronger magnetic field, so they can do up to 9 or maybe even higher strength. But for the animal system, we can go to 21 T, right? So just to give you into some perspective, right? So how strong is this magnetic field? The Earth's magnetic field is only about 0.5 Gauss, right? So 1 Tesla is equal to 10,000 Gauss. You can see how strong is this magnetic field for this MRI machine. And most of these clinical magnets are superconducting magnets, so which require this liquid helium to do the cooling. So overall, with all these components, right, also with these kind of cooling system, MRI machines is really big, right? So you also need a dedicated room to place these machines. And next, we can look at each individual component, right? So the first is the radio frequency coil. So basically, it will send in different frequency of the RF pulse and able to receive the signal back from the patient body. And the grating coil, which is basically trying to encode the position of the proton. So eventually, when you have these MRI slices, right? So you're able to spatial encode, or XYZ, the position. And we finally will have this also very complex or sophisticated computer system, right? Because it's able to control the radio frequency coil to generate different frequency of the pulse, and also able to control the gradient coil, right? So how we can measure different positions. And of course, when we receive all these signals, right, how we can map or reconstruct these signals into something that is, interpretable, like an image. So there's a lot of, engineering into these kind of image reconstruction algorithm, right? So, and definitely that's something for this course we can, focus on, right? So a lot of system, like MI system, we are not able to touch, right, because a lot of hardware, these things. But at least for the algorithm side, right, we can, for example, how to reduce the scanning time, right? So for the MRI machine, if you take a very sparse measurement, right, so can you using some computational algorithm still able to make a very clear, image? Rather, you have to ask the patient to go through a long period of time to take many slices, right? So that's something we can do from the algorithm side. Okay. So if you're interested in more details of the physics of the MRI, so I list a couple of the resources, right? So you can, dive into some details. So the MRI is really complicated. You can spend the entire course dedicated for MRI to understand the fundamental physics behind it. So next we'll talk about, different MRI sequences and how they look like, right? So when we generate these images. So basically, we can vary the sequence of the alpha pulse applied and collected. So then different types of images can be created. So as mentioned earlier, right, so the most common MRI sequences is T1 weighted and T2 weighted scans. So as we mentioned, T1 is basically the time, right, when the proton realign with the magnetic field, okay? And the T2 is the time, how quickly these protons lose their coherence. And based on these properties, right, we can generate these T1 weighted or T2 weighted images. And there's also a common sequence called FLAIR, this fluid attenuated inverse recovery, so called the FLAIR sequence. So this is more like a T2 weighted sequence, but
can you just repeat what are these T1 weighted and T2 weighted?
yeah, so the T1 weighted is based on the the T1 property of the tissue, right? So some of the tissues, like I mentioned, right, because of the different contain varying amount of water and fat, right? How quickly they can realign those protons to the magnetic field. Different tissues will behave differently, right? So this T1 weighted is based on trying to focus on these T1 relaxation time to generate image for that. So similarly, T2 is basically on the T2 property of the tissue. So you can generate another, maybe highlighted different regions, right? So T1 may be highlighted in the water, but T2 may be highlighted in some other soft tissue areas. So we will later see a couple of examples, right, how T1 weighted and how T2 weighted images look like, and also FLAIR. So, but back to the FLAIR sequence. So basically, this is very similar to T2 weighted images, but it's just trying to suppress these like a free fluid. So we'll see a couple of examples, so you will understand how these different sequences look like. Okay. So actually, next slide, I'm also going to show you a video. So there's a doctor explaining these different sequences and how a brain image will look like on these different sequences. Okay.
Dr. Gay from First Tech MRI. This is just a very short video to show you the difference between some of the common sequences we use for MRI. So you may have gone to your doctor and gotten the report, and they mentioned something about something is bright on the T2 weighted sequence, or dark on the T1 weighted sequence, or blooms on the gradient echo sequence, and you may be wondering, what are they talking about? So MRI has multiple different sequences, different acquisitions. So we'll obtain a T1 weighted sequence, and the brain may look like this, and then the next scan we'll run will be a T2 weighted sequence, and then a gradient echo and a FLAIR, and several other ones. And also we do these in different planes, and you can see that there's a different tissue contrast between each one of these, so they have a unique signature for pathology and normal tissues, and using them all together, you'll be able to tell what is going on better than if you had any one. So, for example, a T1 weighted sequence here has dark fluid. So this is fluid in the ventricle, slit-like ventricle here, dark, and fat is bright. So you see around the edge you have subcutaneous fat, which is this band of brightness. You also have bright marrow, has lots of fat in it. And the T2 weighted sequence, the fat is fairly bright as well, but you see how the fluid is really bright. And the brain parenchyma is more dark, whereas in the T1 is bright. So these differences help us decide what certain pathologic processes are. Now, we have a couple other ones down here. This is called the gradient echo sequence. It's really good for if you have heme blood products, if you've had a prior stroke, it'll show up as a dark area. Or if you have mineralization, like in this patient in their basal ganglia, they have some just normal physiologic mineralization, and it shows up as dark. And if someone has had a stroke or a certain type of tumor that has blood products within it, it'll show up as areas of dark like this. So it's not too good for other things, but just for this one purpose. So we include it in brain scans typically. Now this is probably the best sequence we have. This is a newer sequence. And this is called a FLAIR sequence. And the FLAIR is great because there's wonderful soft tissue contrast. So the T1 images, if you look here, you see, well, the gray matter around the edge, the ribbon-like gray matter, and the white matter in the middle, they look really similar, not much contrast. And the T2 weighted sequences, if we window that, it's a little bit better, but still not nearly as good as the FLAIR sequence. There's very good tissue contrast here in the FLAIR. The gray matter looks like a ribbon around the outside. Is really easily distinguished from the white matter here centrally. And if a patient has multiple sclerosis with little specks, or if they have migraine headaches with specks, or a brain tumor, it'll show up really easily on this sequence, whereas it may not be visible at all on the T1 weighted sequence. So you may get to understand now how each one of these sequences is unique, and when they are used together, it'll help us figure out what is going on. And that's it. Thank you very much.
Okay, so just give you a more detailed dive, right? So we can look at these this T1 weighted image, right? So basically the fat is showing bright on this T1 weighted image. And also the fluid, right? The cerebral spinal fluid, CSF, which is in the middle, will show in the dark. So this is like the brain structure, right? So you have this outer side is the gray matter, right? So basically process all the sensory information data, right? So the white matter is the center, basically doing this communication, how these different parts of the white matter will be communicated, right, through this white matter. So the gray matter is gray, and the white matter is white on the T1 weighted image. And on the T2 weighted image, right, so the big difference, the distinction you will see is the fluid now becomes bright, okay? So in the center, right, so here the T1 is pure dark, but now the T2 weighted is bright, okay? And so this T2 weighted image is good for detecting areas of pathology. So basically, so one thing to note is that this fluid or CSF will show on up bright. But for some of the pathology, like cerebral edema, right? So basically, it's like brain tissue swelling, right? So you also see some of the tissues will contain more water content, right? So they will also showing kind of bright color on these T2 weighted image, right? So this is good for detecting area of pathologies, right? Any of the diseased abnormal regions of your brain. Okay. So this flare image, right? So as the previous video showed, right? So they will have better contrast of these different soft tissues like the gray and white matter. So you can see these outer layer, right? The wiggle around. But also the one difference compared to this T2 weighted is this free water, the fluid will also show dark on this flare image. Basically, this specifically trying to suppress these free water, right? And most pathologies also exhibit bright signals on this flare sequence, okay? So this is like kind of side-by-side comparison, just putting all these three different sequences together, right? So we can examine, right? So different parts or tissues, how do they look like on these different sequences, okay? And also I have like a comprehensive summary, right? So all these different tissues, what they look like on these different sequences. I'm not gonna go through all of them, but if you're interested, you can just check this table. As I mentioned earlier, right? So one thing to note is that because the flare is specifically designed to suppress free water, right? So the water will show on the dark. But you may be wondering, right, this fluid or edema, why it shows bright? So this has some difference, right? It's just free water, basically, or this fluid edema, right? So basically contain other content like proteins, other things, right? So they behave differently as like the free water. So typically they will also show bright on the flare sequence. So that's why this T2 weighted and the flare is better at able to help you to better examine those pathologies. Okay. So next we'll look at the MRI machine, right? So what is the MRI machine actually look like, and when it's in operation, right? So how different, as we see previous video, right? So we see X-ray and the CT, right? Let's also take a look at this MRI scan. Okay. See, you can play this.
Thank you for joining us for another video.
So I'm just gonna, this video, they shows different, how they generate different sequences, right? And also, different grading coil, how to do the spatial encoding. And they have some distinctive sound, okay? Just look at one sequence. Okay, so here is T2 corona view, right? So they have this kind of sound. Okay, let's look at another one. Right, XOT1. Okay, so this is another view. So fast spin echo, sagittal T1. Gradient echo is another sequence, right, we see in the previous slide, right? Let me see if I don't. Okay, so this is just, not trying to annoy you by these noise, but just to give you a sense, right, how these MI machine will sound like. So that's why in the first video you see that when the patient goes through the MI scanner, usually have a headphone, because this is a really loud noise. Okay. So, but you may be wondering why these MI machines make such loud noise, right? In the CT scan, I also showed a video, right? So how they spin, it seems like it's awfully quiet, but why MI makes such loud noise? So there's several reasons. So one is these grading coils, they vibrate, right? So because they are interact with this strong magnetic field, right? So they will cause vibration. So these vibration will causing this kind of knocking and buzzing sound. And also because these radio frequencies will send in different patterns, right? Different sequences. So different sequences, like faster, slower, interact with these coils and the magnetic field. They will have a different repetitive sound. Okay. And also the gradient strength and the speed will result in either a loud sound or maybe more frequent knocking or buzzing sound. So that's like the explanation, right? So why these MI scanners have these different sounds. So and safety is very important in MI operation room, right? So not just for the patient but also for any personnel in the room. So because MI room has strong magnetic field, right, at all time, so there's strictly prohibited to bring magnet objects into the MI room, right? So you have to remove all these items, before you go into the MI examining room, okay? And if you have some like implant, like a wearable earplugs, or some implants like heart implants or something like that, maybe you're not suitable, for MRI scanner, because if you go inside, then, those will have some disasters, if you have some hardware implant. Okay. Of course, the headphones and the earbuds is going to be, as also the protective measure for your ear because of these loud sound. Okay. Okay, so here is an image comparison, right? As I mentioned, right? So different the strength of the magnetic field kind of have the effect on the image resolution. On the left side, this is an image using 3 Tesla, MI scanner, right? So this, although we can see very clearly all of these different tissues, even blood vessels, right? But if you look at on the right side, if we're using a much stronger magnetic MRI machine, so you can see more details, right? Especially these small blood vessels. So I think this will be very useful if you need very clear, high-resolution images for some research purpose. Okay. So, and here are a list of the Nobel Prizes, from physics, chemistry, or medicine, right? So, a lot of these were awarded to MI-related technology. So, as you can see, that this is really a revolutionary technology that is able to help advance the medicine, right? Next, we'll see a couple of clicking use of using MI, right? So the first one is using the MI to detect the herniated disc, right? So this is the spine. So this is the T1 weighted sequence. So the disc is basically, you can see the spine has multiple sections, right? The segment. So this disc will serve like you can think of this like a cushion, right? So without this disc, these segments will be basically touching each other. You will feel very painful, right? So these discs will serve as a cushion, right, to absorb all these kind of vibrations. But a herniated disc is basically some of the fluid from the disc will be kind of leaking out, right? So you can see that. So if you can see my mouse here, this is a herniated disc region, right? So a lot of fluid. So from the disc, which is like a gel lag, right? So the medical terminology is called the nucleus pulposus. Okay, so I don't know if you can see this. So that's the terminology for that, right? So basically, it's some type of fluid. Okay, so you can using MRI to easily detect. So this kind of herniated disc. Okay. There's also some other disease for the spine, right? So associated with disc, right? Not just herniated disc, but sometimes you have some degenerated disc, which means maybe this disc does not fill the gap all the way. So we can also using MRI to detect, right? So the disc region, right? So if there's a significant gap in between, so we can also detect that. And we can also using MRI to do this rectal tumor detection, right? So we can detect this tumor. And also mostly commonly used is to imaging the brain, right? So we can do this brain tumor detection as well. Okay, so actually this is a very common popular task, right? Using these brain MRI to do the brain tumor segmentation. Okay, so on this image, these colored mask or pixels showing the tumor region, right? So different color indicating different tumor type, like the tumor core, enhanced tumor, etc. Okay, so one of the programming assignment we have is doing this brain tumor segmentation. Okay. So here is a table just to have a quick summary, right? So the MRI versus the CT, right? So first is the feature, right? So the MRI using magnetic field and the radio waves, but for the X-rays or CTs, they are using ionized radiation. Okay. And for MRI, it is best for soft tissue. So because different tissues behave differently on different type of like T1 or T2 relaxation time, so we can imaging them with different contrast. But for the CT or X-ray, is good for bones, lungs, right? So for some of the dense structure. And for the radiation exposure, right? So MRI, basically we don't have radiation, right? So we only using magnetic field and radio waves. So basically it's very safe. So for repeated scans. But for the CT or X-ray, we do using ionized radiation, right? So it's like a higher frequency. If we look at the spectrum, right, a magnetic spectrum, so they have a higher frequency. And also MRI has excellent soft tissue contrast, and also the CT is better for visualizing these dense structures. Okay. And we also have these noise level, right? So as we see the video, right, MRI is quite loud as compared to CT scanner, and the cost, right? MRI is typically more expensive, right? So we have different component, and also we have these liquid helium trying to cool down, have to cool this magnet, okay? And also there's different safety measures for these different type of machines. I think MRI is more strict, right, because of the strong magnetic field, okay? Okay, any questions for MRI? Okay, all right. So next we'll talk about a different modality, but it's still similar as MRI, but now this is called a functional MRI, okay? So basically MRI give you like the structure of the body, right? The anatomical structure. But sometimes we are not only interested in the structure, but we also interested in the function, right? How different tissues behave over time, right? The metabolism or maybe other functions we want to examine. So this is where the functional MRI is used for, okay? And is primarily used to measure and mapping the brain activity. So the basic principle is we want to measure the brain activity through oxygen concentration in the blood flow. And basically, if your brain is active, some of the regions or maybe in use, right? Like you are reading or you are listening to some music, you have more blood flow to those areas, they will carry more oxygens, right? So this can be detected by functional MRI scan, right? So because it's used to detect this oxygen level, right? So then we can detect, right, which brain region is actually more activated than the other part. Okay, so that's the basic principle of fMRI. So here I also have a video showing the animation, trying to explaining, the underlying principle of fMRI.
How does functional MRI work? You might have heard of functional MRI, or you might even have had a functional MRI scan yourself. The goal of this video is to explain how it works. Functional MRI is a type of magnetic resonance imaging, or MRI. MRI uses a very big magnet inside a scanner to make images of the human body. The human body is made of more than 50% water. Each water molecule in the body contains 2 hydrogen atoms. These hydrogen atoms contain something called a proton. Protons have magnetic properties. When a magnet is present, they interact with the magnetic field. MRI scanners use magnets to measure a signal from protons in the body. MRI is used to make lots of different types of images. Hospitals most commonly use structural MRI. This can show the structure of the brain. Functional MRI shows which areas of the brain are active while performing a specific task. So, what do we measure with functional MRI? Let's look at what happens in the brain when we perform a simple task like looking at something. From the nerve in the eye, signals are sent to a region at the back of the brain called the visual cortex, where brain cells process these signals. Brain cells need oxygen to function. This is transported through the body by red blood cells in the blood. Here, we can see a blood vessel close to a brain cell in the visual cortex. The brain cell is not very active at the moment. When the eye starts looking at something, the brain cell needs to process the information coming from the eye. This means the brain cell needs to work very hard, and so it needs a lot of oxygen, just as you need more oxygen when you're running. The brain cells in the visual cortex demand more oxygen, and the nearby blood vessels increase the amount travelling to that part of the brain. Even more is delivered than the neuron requires. Blood has magnetic properties. These properties change depending on how much oxygen it contains. When there's a change in the oxygen level, the magnetic field around the blood vessel changes slightly. This affects the protons close to the blood vessel in a way that we can measure with the MRI scanner. When there are fewer red blood cells carrying oxygen, the signal we detect with the MRI scanner is lower. When there are a lot of red blood cells carrying oxygen, the signal detected by the MRI scanner is higher. In functional MRI, lots of images of the brain are taken very quickly. The images are then processed on a computer. This creates a map showing how brain activity changes when the brain is doing different things. In the example we just described, we would see a change in signal shown as a coloured blob in the back of the brain, where the visual cortex is. This tells us that this area has been working hard and using lots of oxygen. So, to summarise, how does functional MRI work? As shown in the video, functional MRI is a neuroimaging technique used to show...
Okay, so I think we get the idea, right? So how the functional MRI works. Okay, so here is a detailed image, right? So we can using fMRI to measure, to detect, right? When you perform different activities, right? Which brain area is more activated than the other, right? So in the video, we have seen that if we doing the reading, right? So the visual cortex, which is in the back of your brain, will have more active area. Is the more active area because
we need a lot of oxygen blood flows to perform the reading task. And this is like a FMI settings, right? So the patient will wear this device and you have different component, these cameras, and also this is like an operation. So basically you can perform different tasks, right? So doing different cognitive tasks, and based on that, and we can using fMRI to measure, right, or to detect which part of your brain is doing most activated, and also we can also show some of the, if you have some disease, then we can see maybe some of the area is not active they should be, right? So we can using this to analyze. So there's a couple of applications of the functional MRI, right? So first is we can map in the brain functions, vision, speech, memory, and we can using that to study mental health disorder, right? Depression, anxiety, all these, and we can also using it to understand learning and decision making. Okay, and for the clinical applications, right? We can maybe pre-surgical planning for the brain tumor, right? So if we know that maybe the structure is not enough, but we also have to look at the functions, then we can using structural MRI and a functional MRI together to determine, right, so which part we have to do the surgery. And also, the most common use is to studying the neurodegenerative disease, like the Alzheimer's, right, so any of the dementia, so that is related to your brain function, right, so we can using the functional MRI and see which part does not function as a normal brain, okay. And there's also some emerging uses, right? So it can study the effect of meditation, right? So or exercise maybe can help cure or improve some of the brain functions, right? So we can using that to see how your brain function progress, right? And also the brain-machine interface, right? So how we can using machine, to stimulate maybe some of the area, right? So to restore some of the functionality of your brain area. So that's also some emerging uses. Okay, so that's, the functional MRI is basically a type of MRI, okay? So the next we'll talk about this nuclear medicine imaging, right? So this is also used. So this nuclear medicine basically using some radioactive tracer to assess the body functions and to diagnose and treat disease, okay? And some specially designed cameras able to detect those radioactive tracers so that we can, imaging the functions and how different bodies functions behave. So the two commonly used modalities are called PET and the SPECT, right? So PET is positron emission tomography. So it was used to measure these metabolism, right, metabolic activity. And the SPECT is single photon emission computer tomography, right? So used to measure blood flows and the functions. So the tracer is radioactive, which means that your body is exposed to these radiation. And you may, when you look at these, the term like nuclear, right? So it's kind of scary term, right? So we are exposed the body to this kind of nuclear radiation. But because these, the dosage used in this nuclear medicine is really very, very small, so it will not create too much of the damage to the human body, and also this can be, quickly dissolved or removed through the kidney. And there are some, differences between the SPECT and the PET scans, right? So the fundamental difference is that these two different imaging modalities using different type of radioactive tracer. Okay, so these PET using these positron, and the SPECT using the gamma rays. Okay. And this is the MRI, PET scan, or PET scan and CT scan together, right? So they can do this kind of hybrid imaging. So as I mentioned, right, sometimes you're not just interested in the structure of the body, but you also need to analyze the function, right? So then you can using both imaging modalities and register them, right? Basically, you can overlay them together, register to the same tissue, and you not only able to see the structure, but also analyze the function, okay? So on the left side is PET and the CT. On the right side is MRI and the PET scan, okay? So this is a clinical use of PET scan, right? So we can using these CT images and also using the fused, right, the CT and the PET fused image to detect the tumor. So CT image alone is not able to detect that, right? So if you look at the left image, right, so basically this is like a homogeneous region, right? You cannot see too much of the contrast. But when you fuse that with the PET scan, you can easily detect the tumor region, right, which is this very bright yellow area, okay? So in the past, right, if we want to do this kind of, different imaging modalities, usually, the simple way is you can put these imaging devices or scanners in series or simultaneously. In series, right? So first you go through the PET scan, then you can go to the MRI scan, then maybe you can using image registration technique to fuse them, okay? But now we can combine these imaging technique into a single machine, right? So you can simultaneously do MRI and the PET scan, or CT or PET scan, okay? So then you generate a fused image in a single run, okay? So finally, here's another video to show you this the SPECT and CT scan.
A SPECT scan is used to assess the function of tissues or organs in your body to identify disease. A CT scan provides your doctor with high-resolution images of structures in your body. In other words, SPECT assesses physiology and a CT assesses anatomy. Today, generally a SPECT CT scan is performed where the images from the two different types of scans are captured during one session using a hybrid scanner, and the images are combined. Each piece of information is important, but when combined, they are even more useful. A SPECT CT scan is undertaken in two parts: the administration of the tracer and then the scan that shows how the tracer behaves in your body. A nuclear medicine is generally administered through an intravenous injection, but can also be inhaled, swallowed, or injected in the skin. What study you have will decide how the tracer is administered and whether it is done lying down on the scanner or elsewhere in a chair. The injected nuclear medicine gets taken up and concentrates in the part of the body under investigation. Some diseases cause increased function, some cause decreased function, and some cause changes in function, all of which can be imaged on the scanner. Virtually all organs and tissues can be investigated using nuclear medicine. The most common procedures include the bone to detect and assess changes in bone function associated with cancer, trauma, and metabolic changes, and many other diseases. The function of the heart can be evaluated by examining blood moving through the heart or imaging the blood flow and movement of the heart muscle itself to diagnose a variety of diseases. Nuclear medicine can also be used to study lung, kidney, thyroid, brain, and many other organs and tissues in the body, and importantly, to investigate cancer. Because some body functions are fast and some are slower, the time between administration of the tracer and the scan can vary from minutes to hours. Some people may even be required to come back on multiple days. For diagnostic scans, the nuclear medicine is radioactive and emits gamma rays that can be detected by the scanner. The SPECT CT machine has two gamma cameras that detect gamma rays and produces a map of how the tracer is behaving. These detectors rotate around the body, taking images every few degrees, allowing images to be reconstructed in 3 dimensions. The SPECT scan can take 10 to 20 minutes, and then the CT scan takes less than a minute. The scan collects important information that is processed by a computer. This information is then carefully reviewed by a specialist nuclear medicine physician to produce a report for your doctor. Your doctor will use the information to help determine how to manage your specific health condition or assess the response to current management.
So just to a quick summary of this nuclear medicine and the radiology, right? So these nuclear medicine images, organ functions, right? So the radiology assess anatomy, right? So the structure and the function. The nuclear medicine using radioactive drugs, right? So it will inject it into the patient bloodstream, but the radiology using external source of energy, okay? So like the X-ray and CT. So that's some of the basic differences between this nuclear medicine and the radiology. So finally, I also want to show a quick demo of the MRI data. So we can, again, just like the last class, we can using the ITK software. Let me open this. Okay, so I actually have a MI file open. So just to give you, let's see. So for this file, we actually have different sequences. Okay, so we have T1, T2. This is another T1 kind of enhanced. So we also have a flare. So let's look at each individual. So let's look at the T1. Okay, so this is the T1 weighted image, right? So this the fluid will show the dark on the T1 weighted image, right? So you can moving this around to see, kind of different cross sections of the brain. And let me also kind of load the segmentation. Okay, so we'll load the segmentation label. Okay, so this is the tumor region. Okay, so different color indicating different type of tumor. Okay, so for this brain, actually they have it's like a multi-class segmentation task, right? So the last time the kidney, it's just like a binary, right? The normal and the tumor region. But this has multiple classes. Okay, so when we, change, right? So we can see some of the tumor classes are really have a very small region, especially these, the yellow area, right? So it's like around like the boundary. So this kind of classes is really difficult to segment. Okay, but so now these are the tumor region, right? So I wanted to maybe remove, let's unload the segmentation and trying to see what are the difference between the normal tissue here.
The normal tissue are gray color and it's kind of like black.
Yeah, so if this is like a normal tissue, so this should be like a CSF, right? So you have to be may look like a darker, more darker color. But here actually is like have some other soft tissue here growing, right? So this is T1. Let's look at the T2. Maybe T2 has better contrast, too easy to detect, right? So let's look at T2. So T2 weighted sequence. Is this T2? I did something wrong, I think. Okay. Yeah, you can actually see that, right? So the pathology, as we mentioned, right, the pathology is showing bright color on the T2 weighted and a flare, right? So you can see that there's some very bright color in this region, right? So as we see the segmentation map, that's where actually the tumor is located, okay? And we can also see, maybe to verify that, on the flare sequence, right? Let's look at the flare. Okay, so then this is more clear too, right? So these are the normal tissue, and you can see that these are the pathology, right, where the tumor resides, right? You can see within these tumor region, there's also some contrast, right? So maybe some of the, because they are like a different tumor type, right? So they have different tissue, content. So that also reflect that on this flare sequence, right? So for segmentation task, some people using all the sequences to the segmentation, but you can also using maybe a single sequence, right, using the flare, because this shows more clearly of the pathology. Maybe just using a single sequence, like the flare sequence, you are able to segment the tumor very accurately, okay? So yeah, this is just to give you a quick example, right? So how these slices look like, right? So if I also rotate this, and you can get a sense, right, how this tumor, what's the shape look like for this tumor, right? So when we kind of scrolling down, right? So here is like a very top region section, right? And these are all the normal tissue. And then we going down, then we gradually see that, right? These tumor appear, okay? Okay, all right, so that's, I think that's all for today. Any questions? Yes?
I have a question regarding if you had work back from the art team.
Yes, so they've created account for us, but they didn't send me the instruction, so I just requested. So they give us 25 account. I don't know if everyone need account, but we have 28, but they can only assign us like 25. But later, if we need it, we may have to request more. But once I have all these information, I will send out to everyone with the announcement. Okay.
Okay.
Yes.
For getting these labels, they use like a PET scan in order to create this label that you have.
No, the label is manually. So it's done by the physician, the expert, to do the manual labeling. Yes, yeah.
And what you're visualizing here is just the MRI. There's no the PET.
No, there's no PET scan. But like you mentioned, like maybe we can using PET scan to give us more accurate. And then maybe, to give us like a rough indication where that is. Then you can spend less labor on actual pixel by pixel labeling.
Maybe you can create a label with a PET scan.
Yes.
Possible.
Yeah, that's also possible. Yeah, for that. Yeah, but for this Brett's data set, actually, this is created by University of Pennsylvania, so they using all these experts to manually label because this is a collaborative effort. They are doing this every year for the challenge. They are keeping adding the patient and the data. So yeah, this is like a very large scale data set for brain tumor segmentation. Yeah.
So the segmentation is kind of like preloaded, like pre-leveled, something like this?
No, the segmentation for this software, I actually have the label. So I just like I showed, right? So you can load this label. This is just for visualization purpose. So you can see where that tumor is, but the label, as he asked, right? The label is created, labeled manually by a human expert. Yeah. Yeah. Okay. Any other question? Okay. So yeah, I think for this course, this is just give you some very brief sense. So of course, I'm not an expert in all these imaging modalities, but this just give you a basic sense, right? How these images look like, and later maybe you can using some of the unique properties, maybe to design your algorithm, right? So when you have these different sequences, how these sequences, may look like, or different tissue will be more prominent on specific sequence, maybe you can take in that as a prior information or prior knowledge to design your algorithm, right? So, of course, you can using all the data, but that come at a cost of more computation, right? If you have some modalities or sequences that give you enough information to make a very accurate segmentation, then you can only using that, right? Okay, so that's all for today. And for the next lecture, we'll also talk about other type of imaging modalities like optical imaging, and also I'll talk about some of the EEG as well, and also these microscopic images, right? A lot of digital pathologies, we have to analyze these microscopic images as well. Okay. 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 All right. Thank you, guys.
I have doubt about the project. The project can be, I have seen the project idea and the list, the PDF I have seen. So is it something related we have to do the project only based on images, or is it okay to do with the data sets?
Other data set like what?
Other data sets like if hard disease prediction, like hard disease indicator, something like that. Like
yeah, hard disease, does that involve images or?
No, I just want to know, like it's.
Yeah, it will be better if you can incorporate some images as well, because if you're just doing like a text based, then that's like a pure P classes, right? If you're like so, just I would see some imaging component. I mean, you can use in multimodalities like text plus image. That's fine. But I just want you guys to practice.
Either how to one image is fine, or like kind of one column or one feature if I add it.
Yeah, you can add like an image feature as a type of feature for the heart disease prediction. That's fine. But like I said, I would love to see you also dealing with imaging modality. Yeah, okay. That'd be good. Yeah.
Okay. Thank you.
Yeah. Okay. Yeah.
So essentially, like I'm looking for some potential ideas around. So essentially, I want to work around some of this. I want to explore some of this bias in VLM in terms of medical image computing. Do you think you have? So for example, there was one recent paper that has the paper called Fair Clip, in which they take a data set from some Harvard data set and they do the contrastive blending on the top of clip, and they generate this fair clip, and they say that okay, this is a more anonymized version based on some clinical notes and etc. So do you think we can explore this visual bias and some downstream task based on some medical image? Do you think that's possible, or because essentially some of these images are just X-ray images and images like that, right? They're not actually the images of a human and anything. So to explore the bias and something related to privacy and these, we will need to go to the textual modality in this clinical descriptions, right? Do you think it's anything that we can do with the image part that is related to the medical image computing? So like you had a recent paper on biomed GPT, right? So that's essentially that answers questions related to some medical tasks. Is there anything that we can do on the visual side related to the privacy and bias? In the
so the privacy you can do is so we will talk about federated learning in the class. So that's kind of like privacy related, right? Because you don't share the actual patient data during the training. So that could be one thing. But to the